Hello, everyone. Welcome to the next webinar in the Optimi Health series. Today, we're going to talk about return to play. For those that don't know me, my name's Shane Katanagara. I'm the Chief Clinical Officer of Optimi Health, the former head physio of the New South Wales Waratahs and the Australian Under-20s rugby team, currently working as a physio for the Melbourne Storm in Australia's NRL and for the Human Performance and Optimisation program at the RAAF in Australia. Today, it's a pleasure to have Emily Lees with us today. Leesy, introduce yourself.
Yeah, hi everyone. I come from a background, I spent 8 years playing cricket professionally in Sydney and then transitioned over to the staff side of things, working as a physio at the Waratahs, Australian Under-20s in rugby, and then currently head physio of the Sydney Swans AFL women's team.
It's a great privilege to have you on board. Thanks for joining us tonight.
No problem. Happy to be here.
Yeah, nice. So today we'll cover a few things. We'll talk about earning the right to returning to either running or playing sport. We'll briefly have to touch on some basics on how quickly we lose fitness. And there is a difference between returning to play with respects to short-term injury and long-term injury, and we'll go into a bit more detail around that. After that, we'll talk about how to plan your return to play. We'll talk about periodization being how we plan our volumes or our running loads coming back from an injury. And lastly, the end stage criteria for return to play. So earning the right, training, running, playing sport, as we all know, is not easy, particularly as you get older, like me. So I think, running is challenging. It's taxing on the body, and we've got to have enough strength in our tissue to be able to deal with that type of force. So we spoke a bit about this before, that injury occurs when the force on a tissue exceeds the capacity or the strength of that tissue. So we've got to get to a point where your joints and your muscles are strong enough to run. This is a little graph from a well-known author, specifically talking about the demands on the calf Achilles complex. And you can see that that first blue column is your calf raise, and it's nowhere near the force that is required to run at certain volumes. So, just doing calf raises for a return to play and then expecting that you can run generally doesn't bode that well for calf Achilles complexes specifically. And we need to structure that rehab in a way where we bridge the gap between what is the demand of the sport or the demand of running versus the capacity and the strength of that tissue. Another good example is in sprinting. So in sprinting, actually nothing really mimics the amount of force in a gym setting that is produced on the hamstring when we sprint. The closest thing would be a Nordic curl, which we can't do every day, nor can we sprint every day. So it kind of just shows you how hard it is to bridge that gap between sprinting and, let's say, jogging with respects to hamstrings. So moving from muscles to joints, what I normally tend to say to my patients is that muscles are the shock absorbers of joints. So if your joints are sore, whether that be knee or hip, the best way to mitigate the risk of pain in that respect is to get your muscles strong, your whole chain. So your calf, your quad, particularly for knees, your glutes, and your trunk, particularly for hips. So the stronger we get through those important muscle groups, generally the less pain that our joints feel. So how quickly do we lose our fitness? Unfortunately, very quickly, and it's easier to lose fitness than it is to gain fitness, and that's a real shame. So some of the research that we have here is that conditioning declines within 7 to 14 days, 1 to 2 weeks. At 2 weeks, it's roughly 10%. At 1 to 2 months, we're looking at 20 to 25%. So it's quite substantial. That's why it's very important. A little motto that we use is talking about what we can do rather than what we can't do, because any type of volume, so long as it's safe, is good volume. And any type of fitness, even if it is I can't run but I can get on a bike or I can get on a rowing machine, is a good way and a good adjunct to keep our conditioning fitness up. With respects to strength, so strength declines within 2 to 3 weeks. And we all know, those who go to the gym, how hard it is to get that strength back up after we have a little bit of a break. So again, it's a matter of what we can do rather than what we can't. If your shoulder's sore and you can't do overhead press, then perhaps it's just easier to do some type of pulling movement, which is a bit easier on the shoulder. Something is always better than nothing in order for us to lose strength and conditioning less faster, I guess. And ultimately, returning to running and returning to sport depends on the amount of time that we have out. So again, based on this literature, if you're out for more than 2 weeks, we have to start to plan our volumes and our return to sport a little bit more accurately. Otherwise, we increase our risk of injury on return, which we know in the science is high. And so it's important to plan that once we get past a certain amount of weeks out due to injury. So moving on to short-term injuries. So short-term injuries are a bit of a hiatus if you away. So it's important with respects to injury that we pass our criteria or our markers before we return to sport. So I gave an example there on the slide. Repeat pain-free coordinated hop for an ankle sprain generally is a decent marker after you rolled your ankle. And we love this, which is in the short-term case, at least one full training session to be cleared for return to play. So in the running perspective, it would be at least one group coach training session before going into competition, ideally in running a lot more. And then on top of that, we also need to not only pass criteria with respects to injury, but also look at our volume. So again, if we're kind of past that 10 days, 14-day period, we could look at something called your acute chronic workload ratio, which is something that we use in the science, something that we use in Optimi, where we look at the volume that you have in 1 week and you divide it by the average volume that you've had over the last 4 weeks, and it produces a ratio. And our ratio ideally is between 0.8 and 1.5. A little bit confusing, but again, it gives us a scientific measure on how we plan our volumes. And whether we actually need to rebuild a little bit more because we've been out for 3-4 weeks, or whether we can get away with it because our volumes were high enough to begin with. So there are scientific ways to assess this. I'm going to hand over to Emily. She again works for the Swans, so she's really in tune with the long-term injury cases.
Yeah, unfortunately, we see quite a few of these in our work at the Swans. I think similar to the short-term injury, we're very guided by markers. The only thing is that we have to kind of take the amount of time you've had out into consideration. So we have a saying at the Swans that begin with the end in mind, and we have to work out where we're trying to get athletes to. And it's the same if you're a runner or a social soccer player or whatever it might be. What are you trying to get back to, and where are you at now? And then how do we gradually bridge that gap? So we have strength markers, as Shane spoke about, how we get you back into running first, markers to start changing direction, and then starting to build you back into training. This usually takes a little bit longer, the longer you've been out, and we sort of work on the amount of time that the athlete has been without running is the amount of time you need to build up before you return to full training or play. So, for example, if you've missed 4 weeks with a calf strain, we usually build them up over the next 4 weeks back to where either they're normally at or where the rest of the team are at. And I guess that's the main difference between the short term and the long term, is that you just have to take that little bit longer and go a little bit more gradual. I think the markers stay relatively the same. It just takes a little bit longer to get back to those volumes. As I said, planning, where do you start? How do you plan this stuff out? Basically working out where you want to get to. So for a runner, it might be, do you have a 10K race in mind? Do you have a half marathon in mind? If you're a local rugby player or cricketer or whatever it is there a particular game or a length of game that you're trying to get back to? And what's the worst case scenario? We talk about that a lot of time with our players. So when they're playing full game at full tilt, what does that look like for them? So for certain players, that might be a 10K game in our sport, or there's other positions that will do a little bit less. So it's what the sport you're in and what event you're trying to do, but also for the individual. And then where are we starting at? How do we build you up to that distance or time on field? In terms of how many training sessions do you need before competition? Again, it probably depends a little bit, as Shane alluded to, on how long you've been out for. We like to say if it's a short-term injury, at least one full training session before you play. And that training session has to be pretty close to what you would be doing in a game. It's hard to replicate that intensity, but at least to give you some confidence knowing you're going to get through it. If you've been out for, we generally say 3 to 4 weeks, you have to have a full week of training before you get back into things. So if you're a runner in a run club, it's probably getting it through a full week of that running training before you go and do a competition. And then what does that training session look like? Like I said, there's a hard training session, and then there's your light recovery type runs, or we call them captain's runs in AFL. The demands are much different, very different compared to a game. So in our game, they do a lot of sprinting. If you're a long distance runner, it's probably a little bit less on the intensity and more on the volume side. So it's just, again, really going back to what's your end goal and what does that require on the body and how do we get you there? And then we try to progress no more than 10% volume a week is a really good number to work on. So if you're adding 10% each week from where you're at, that gives you a pretty good idea of where you need to get to and how long that's going to take.
Thanks, Em. Hey, our listeners will be very good at tracking their own data. What are the metrics? I am interested in actually. What are the metrics you guys use in AFL with respects to the GPS that you see?
Yeah, it's a really good question. We use GPS for every training session, and a big training week for us will be 30 Ks a week for our girls. A big session is 10 to 12 kilometers per session, and we tend to do, depending on the time of year, 3 to 4 sessions a week. So they're not all big sessions. Every session is not equal. We kind of periodize the week, go up and down a little bit, and then different sessions will have, there'll be longer, slower sessions, and then there'll be shorter, sharper, more high-speed running type sessions. The other thing we use is wearables. So we've got a really good example of a girl with a calf injury at the moment that she's not doing much running or team training, but how do we make sure we're getting her load right? Shane, as you know, people walking around loads their calf. So we've actually got a step count on her. So every day we give her a step count that we don't want her to go over, and then we're gradually building that up as well. So even if you don't have the luxury of GPS like we do, the wearables are a really good way to count your load as well.
Yeah, sounds good. Do you look at certain types of high-speed meters or acceleration still?
Yeah, we do. So we look at what we call junk running, so anything below 16 kilometers an hour. From 16 kilometers an hour to 20 kilometers an hour is what we call high speed running, and that's sort of your middle ground. You're loading the tissues, but you're not at that top end. And then anything above 20 kilometers an hour is our sprint or our very high speed. And then, as you mentioned, accels and decels. So there's lots of different things and ways you can load the tissue. And we're really lucky because we have previous data. We look at what has that player done in their biggest game ever from all those different metrics, and we try to make sure we've hit those before we put them back into a game. So intensity of training is different to a match, but at least you know you've put them through the same numbers that you can expect them in a worst case scenario to hit in a game.
I like it. I'm not sure if I could ever get past junk meters. 16 k's an hour. That's impressive.
Yeah,
they're very fit. All right. So the marker criteria based approach. So we prefer this over time. I think in general, sporting teams, professional sporting teams also look at this and prefer this over time. We also have to respect the pathology, don't get me wrong, where if we know what the underlying issue is, let's say soft tissue injury, it'd be silly to push them beyond the limits of true recovery, let's say, of a piece of tissue. However, one classic example is the beginning of a Waratah season, our hooker went down in the last trial, which happened to be 10 days before round 1, with a grade 3 posterior cruciate ligament rupture, so full thickness rupture of his PCL, and he came back for game 1. So ordinarily that would be at least 4 weeks out, but his function was good, his effusion or his swelling was low. he was able to hit a full training session before round 1, and we saw no reason for him not to play. So probably not advisable in the general population setting, but gives you an idea that using the marker or the criteria-based approach is both actually safer because you're hitting certain markers, and it also allows us to individualize return to play or returning to run based on the individual. So some people just recover quicker than others, and some people take their time. So some examples there of some criteria for returning to play: 2 full weeks of group training before competition. So that's something that we would use, I don't know, typically for something between a 3 to 6 month injury. You probably want at least 2 full weeks of group training or field training, including contact in rugby or AFL before competition. You probably want 90% of hamstring strength, so however way you want to assess that, before returning to speed. Full calf strength and normal repeat hop for a calf or an ankle issue before returning to run. Pain-free single leg squat before returning to lower body weights in the gym. So you've got to be able to do some repeat single leg squats just for your body weight before you start to load up a barbell heavily on your back before you do 2 leg squats, for instance. Our Optimi self-managed programs use the criteria-based or marker-based approach, whether you're in the prevention programs or the pain programs. We use certain criteria to allow you to progress to the next stage of rehab. Again, that allows our programs to be safe and tailored to you, whether you are trying to treat a knee issue or trying to prevent a calf or an Achilles issue because you're a runner. Early stage running tips. You're probably more of a runner than I am, Lizzie, so I might hand this to you.
Yeah, I'm not at the moment. I've managed to give myself an injury, so it's very much do as I say, not as I do at the moment. We use this stuff with our girls all the time. So our first couple of weeks of running, actually, we don't ever really go back-to-back days with our training sessions. Our main training days are Monday, Wednesday, Friday, and that's a really deliberate choice to make sure that they're getting plenty of recovery time between sessions, even when they're fit and healthy. I think that's particularly important when you've gone from a period of injury or you haven't been training, is to make sure you're giving yourself that loading the tissue on a day and then giving yourself plenty of time to recover so that you're not exposing yourself to that increased injury risk. I know, Shane, you mentioned that you'd heard of this 5 in the first 2 weeks for long-term injuries, and we actually use that quite often. Particularly, we get a lot of bone stress, and we use that early days. We talk about 72 hours between sessions in the first 2 weeks, and then you can kind of progress along a little bit. And all of that is about preparing you to run and making sure that you're getting plenty of recovery time. We're really spoiled at the Swans. We have some really good recovery facilities, and if they're not recovering well, then we actually don't let them get back on their feet for that second or third run. Calf strains, it's a bit of a touchy topic for me at the moment. We've had a few of these, and they can be quite tricky. I think just being conscious of time on feet is loading your calf, so it can be a little bit longer to get going, and they have a high recurrence rate, especially early on, which is very different to your hamstring strain. So we talk about volume and intensity. So calf strains, it's the volume that's the issue. You can actually get running at high intensity, and we'll talk about that high-speed running quite early on, but it's the total volume in the session that tends to make you come unstuck, whereas a hamstring, because of the different demands a hamstring has when you're running, you can actually build out some really good volume early at lower intensity. We talk about staying below 80% of your max speed, but the risky period is when you're starting to reintroduce that speed. So it just goes to show how you have to individualize stuff for you specifically compared to the next person, but which body part you're trying to get back as well, and being mindful of that.
Yeah, I agree. I'm interested in the calf strain. So we had that first slide where running junk meters is actually quite taxing for the calf. And we saw that a calf race, for instance, which is what most people do for calf strains, doesn't meet anywhere near the requirement to run. So how do you kind of bridge that gap with calf strains?
Yeah, it's a really good question. We've learned a lot, mostly from getting this wrong over the last couple of is we do a lot of stair walking, so you can load it. You're not quite loading it as much as running, but it's better than doing a calf raise. We do lots of jumping, pogos, hopping, things like that to try and get a little bit of that speed of contraction. Again, we use step counters throughout the day to make sure that we're not going from 2,000 steps a day because they've been resting back into 15,000 steps. But yeah, a lot of it is that gym-based hopping, jumping, stair walking is kind of the main thing we use rather than just the purely slow controlled strength stuff.
Nice. And are you guys still doing lots of that hip conditioning stuff? You know, that was kind of popular in the, I don't know, late 20 teens era.
Showing your age now, Shane.
Yeah.
We do to an extent, particularly early days. We're really lucky that we don't need to train 100-meter sprinters who need to run perfectly in the right position and hundreds of the seconds, the difference between them winning and losing. So I know it probably was a little bit in vogue more so previously in thinking about having the perfect technique. I think we less worry about that, and it's more just getting load through the tissue rather than are they doing it perfectly. And we do a lot of it early on. But then we sort of, as we increase our running volume, we probably drop off a little bit on that drilling stuff. But it's more about getting the load in them, bridging that gap, as you mentioned earlier, rather than teaching the perfect running technique.
Nice. My two bob with that is that it's extremely hard to quantify that hip conditioning stuff. It's very, very sneakily taxing on the body, particularly the calf Achilles complex.
100%. And we try to quantify it in terms of just contact time. And we put a time limit on it, and we absolutely don't. It's not the be all and end all. We just use it as a sort of an intro and then drop back as we need to.
Nice. Thanks. So once we got a few runs under our belt, it's time to build up your running volume. So Emily mentioned it before. It's about working backwards from what your team or your group or the competition demands are, understanding what the actual metrics are that you're building backwards from, and then again, working and planning out your running based on that. So as we keep mentioning, it depends on how long you've been out for. I loved Emily's analogy on if you've been out for X weeks, then you're running for X weeks to get back your conditioning. So again, some examples, again, not gospel, but yeah, same runs in the 5 and 5-2, then build up. So in the early stages, something along the lines of a Monday, Wednesday, Friday type of setup, and then the following week heading into a Monday, Thursday type of setup, and then going again. And mentioned it before, so adding 10% volume / no more than 10% volume per week, or using the acute chronic workload ratio for your build up. We have found as an accurate way of doing this. Now, on top of this, as you're building up, Em mentioned it very briefly, is looking at recovery and seeing how you recover from the volumes that we put through you. So that's called internal load. So external load is the amount of volume, the quantifiable volume that you're putting through your body. So for instance, in running, it might be mileage. In weights, it might be how much you're lifting and how many reps and sets you're doing. But your internal load is how your body perceives that external load. So I think it is also important, and we've said this in previous webinars, to track both your external load, which everyone's pretty good at, but also tracking your internal load, which is how your body is, again, perceiving the external load that's being put through your body, particularly coming back from injury. And being prepared to be flexible, which is ultra important, and again, touched on by Em, ultra flexible to be that if your internal load is high and you've got increased perceived physical fatigue or stresses, that again, you can still try to do something if you can, but maybe mitigate the risk a little bit. So for instance, for hamstrings, if it's your day to increase your speed, but you're not feeling 100%, then just go for a jog rather than exposing yourself to risk by trying to do a sprint, because that's what the plan says. Again, yeah, sorry.
Sorry to interrupt, Shane. I think that's a really good point. We talk about with our players not playing catch-up. So we actually we have a couple of doctors on our list, and they might come off a shift that's quite long or stressful and not getting that great of a sleep. And we're really fortunate, again, to be able to track their internal load through an app we use, but not playing catch-up. So if they do come off and they do have that flag on that internal load, that we get through the bare minimum, and that might be just prioritizing football skills and, like you said, not not worrying about the running fast, and they don't need to catch that up later in the week. That just is what it is, and it'll naturally sort itself out.
Yeah, I like that. We've also discussed the 3 colliding variables to injury in the past before. So, you know, that's a great example. Semi-professional athlete coming back from rehab, hasn't had much sleep because she's been on night shift, and might have, you know, an increased amount of stress as a result of that. So you've got lack of sleep, you've got heightened stress state, and you've also got you're coming back from rehab, which means your volumes are low. They're the ones that are at risk of injury. So assessing your variables to injury, and in our case, the 3 variables to injury, we feel is a good predictive measure to injury. Again, the Optimi app has a couple of features with regards to this. So we've got the training load features. So if you just plug in your volume, plug in the amount of minutes that you've trained for, and your rate of perceived exertion, which is how you perceive your training session. That is a very well tried and tested method in professional sport. We have all these gizmos and GPS data, but ultimately time multiplied by RPE is a great measure on training load. And we put that through the acute chronic work rate ratio, make it easy for you. And after 4 weeks of data, we can start to produce accurate ratios, and we'll also then flag when you're spiking with regards to your load. So in the first 4 weeks, we still give you advice on how to build that up intelligently. However, the feature really comes to light after that 4-week period. And we also have a wellness platform as well, which then tracks your internal load. So it allows you to track whether your internal loads are starting to spike, and then you can have a look at how you are and your body is reacting to the build up if you are coming back from injury. So get stuck involved, have a look. Integrating back into the group. So back to sport. So we're back to M on this.
Yeah, I think this is probably the trickiest part. I think things tend to naturally get better by themselves. You can do all the fancy rehab in the world, but things will naturally get better. I think the trick and the risk comes from when you're trying to get them back in with the group, and rehab runs and reloading is in a really controlled environment, and then you kind of throw them back into the group and you lose control. So how do we try and mitigate that risk is kind of the question we're always asking ourselves. And the riskiest period for re-injury, I don't know what your experience is, Shane, but that's sort of, we very rarely have re-injury early in rehab. It's when you're getting them back into training that you tend to have those little slip-ups. And I think we go back to the begin with the end in mind. So what is the group doing when you're aiming to get them back in? And we never throw them back into a full training session, particularly after those longer injuries. We call them modified. There'll be a couple of weeks in modified training. And like you said, Shane, we look at what they can do rather than what they can't do. We pick out what are the really risky things for their particular injury, and we sort of put a cross through them. But then out of the rest of the session, what can they get? So for our girls, it might be stationary kicking, or we call them fundamental skills first, but getting them to do non-contact things before we're putting them back into contact. So it's really important to understand what the group's doing. So if you're a runner and you're part of a run club, it might be, what is that session that you're planning to go back? Is it a 10K really fast run, or is it a 5K nice easy run? And those 5K nice easy runs might be a better starting point. Or if it is that 10K fast run, do you do 5Ks of it instead of the 10K? So how can you bridge? Again, we talked about bridge that gap. I'm sure you've had this experience, Shane, but the hardest thing is when you're working with a coach and coaching staff and their goal is to win titles, or the coach trying to make you run faster and run a PB. That's their number one goal. And our goal is to make sure that the players aren't injured. And sometimes those two things are at opposite ends of the spectrum, and trying to get them to marry up can be really tricky. I think it's important to sit down and have that conversation with the coach so that they understand the risks and what is at stake if you do kind of push things a little bit early or you don't get this right. And they might get frustrated with it, but they'll also get super frustrated if you get re-injured and you're not available for the next 4 weeks. And I think it's a really tricky thing to try and navigate, and it takes practice is probably my advice with that one.
No, I agree. I always found that the hardest part of being head of a program, head of a medical program, is having that hard conversation with a coach, particularly with a key player. And the coach, he or she would grill you pretty hard to get them back either with the group or get them back a week earlier. And then I always found it easier just to have some evidence behind me to make the decision, which was, if it was to hold back the player to make it a bit easier. Inevitably, there'll be a little bit of compromise, which is great, between performance and medical. It's always a fine line.
I think the other thing is really important is athlete buy-in, and we talk about that a lot. And for those listening who are the athlete or the runner, it's really important to understand why the physio or the doctor or whoever it is saying why you can't do stuff, so that you can make a really informed decision and understand the risks and understand what they're trying to do. And that helps with the communication with the coaches. Coaches will get frustrated, but there's very few that will disagree with you when they understand why. And it's important as an athlete to understand your body and understand what people are trying to get you to do or not to do.
Yeah, that's nice. And I think the one poignant statement that you made there was getting into training and the risk involved with getting into training. I think, I'm not sure whether you believe in this statement, but rehab running or running by yourself doesn't replicate running with a group or field training. And definitely when you return to competition or return to a game, unfortunately, no matter how hard you go at training, I just don't think it ever replicates a game.
No, I totally agree with that. We watch what our girls do in training, and then you watch what they do in a game, and you're always much nicer to your teammates than you are to the opposition. So it's really important. I think we've spoken about it in the past, Shane, is making sure that you've got that worst case scenario and you've gone over on what you need to do in that controlled setting, because that added uncontrolled intensity will only add load. So you need to make sure that you've exposed them to the controlled stuff over and above what they need to, because you're exactly right that you can't replicate it. It's really hard.
Yeah, nice. And it goes back to that statement that the force produced on a piece of tissue in a game is going to be substantially higher. So we need to be super maximally strong in training before then we expose our players or yourself to those forces in competition.
Yep.
So end stage criteria for rehab, we're looking at passing most, if not all, criteria before returning to play. I think full training before you play is extremely important. And we talked about how the longer you're out for, the longer we need to train for. So, up to 4 weeks, if it's an ACL reconstruction, in my opinion, I think you need to really expose yourself to lots and lots of training before you come back from an injury that's anywhere, past 9 months to 12 months. It's important to look at ongoing prevention. Again, in previous webinars, we talked at the highest risk factor for current injury is previous injury. And so those who are coming back from injury should be doing some kind of continued preventative work with respects to the injury that kept them out in the first place. Prep and recovery. So again, Em touched on it. So preparing yourself really well for a game, whether that be your warm up, your ramp protocol, your activation, your rollout, functional preparation before you run/play, and how you recover, particularly, in rehab, how you recover, whether that be getting into ice baths, whether that be putting an ice pack on your swollen ankle, but just systemically and most importantly, eating well and sleeping well. So we have all these fancy gadgets and all these fancy stuff with respects to recovery, but ultimately the efficacy mostly lies with good sleep and good nutrition. So I want to end with a couple of studies, highest risk early on, not to scare the bejesus out of you, but to just to put it out there that what we're saying is the risk is early. So you're at twice the risk of re-injury in the first 10 days of returning to play, and the risk halves after 4 weeks. So again, it's very important to gradually increase your load when you're returning to play. We haven't mentioned this, but when you return to play and you have an option, you can't do this in a run when you're in competition because 10Ks is 10Ks. But when you're in sport, you have an option of just limiting minutes, particularly in the general population environment, harder in pro sport. And you can build up your minutes. Let's say in a game of football, you can start at 30 minutes and then you can build up to 50, 70, and then 90, for example. So you're returning back to a full game, but it's 4 weeks after you've actually returned to play. Moving on, we've got 4.3% greater increase of hamstring strain if you've injured your hamstring in the past 12 months. So that's pretty damning stuff. And then lastly, your risk of ankle sprain increases between 21 and 50% more after a previous injury. So the way we mitigate that is either by using a supportive measure like a brace or ankle tape, or by doing proprioceptive rehab or balance exercises. And we talked about that in ongoing prevention. So anything more to add, Em, from your end?
No, the only thing I was going to ask is usually what's your guidelines to say someone has successfully returned to play from, say, an ankle injury? How long after that would you normally tell them they need to keep doing their rehab exercises?
Oh, that's a doozy. This wasn't part of the prep. So ankle tape, I go 18 months. So I believe supportive measures can be used. It's an easy cheat code, I call it, for ankle sprains. So 18 months post-injury for supportive measures, whether that be a lace-up ankle brace, not the wetsuit type of material ankle brace, either a lace-up ankle brace with stirrups, which has the efficacy behind it, or ankle tape. And with the balance exercises, I take them to the end of the season. So if that's a month out from the season, I'll just see it to the end. But if it's at the beginning season, they've got that adjustment the entire time to their program. Now, that is non-scientific. That's the world according to Shane. I'm going to throw it back on you. What about you, Em?
Yeah, we usually do the same, to be honest. And we talk about that 12 months, getting through 12 months without injury in it, particularly with bone stress. I know you've got some good stats there, but with bone stress, we see it a lot in our young female athletes that they're 6 times more likely to have it in the next 12 months. So we do the same thing. It's till the end of the season, continuing with their rehab. We might drop off the number of times a week they do it. So they might go from every day doing it back to 2 or 3 times a week to get that maintenance dose. But yeah, we definitely keep them going. I think you would see it commonly in your general population patients that they don't have pain anymore, so they stop doing their exercises, and then would you believe they get injured again. So I think it's really important that just because you're not painful and you're back doing what you want doesn't mean that the chance of injury is gone away.
Yeah, nice, well put. Well, Em, thanks for your time tonight. It's been a privilege again to have you on the webinar series. It was actually a lot of fun tonight. It was good. I learned a bit myself, so thank you.
Thanks for having me.
And thank you for everyone who's listening. I hope you can join us for the next webinar for Optimi Health. Cheers.